The following video will focus on emergency care for the adult casualty who is 8 years and older.
Good day. My name is Nick Rondinelli, and I am a first aid and CPR instructor trainer for the Canadian Red Cross. Welcome to the CPR Educational video.
When the breathing stops, the heart will soon stop beating. 0 to 4 minutes, clinical death. 4 to 6 minutes, brain damage possible. 6 to 10 minutes, brain damage likely. After 10 minutes, irreversible brain damage, biological death. Are you prepared?
Gary, and no pulse. Okay, resume CPR.
Come on, Dad!
In this video, you will learn life-threatening emergencies and the life-saving techniques to deal with them.
In this video, you will learn rescue breathing for respiratory arrest, which means the person has stopped breathing. You will also learn how to perform CPR, known as cardiopulmonary resuscitation, for cardiac arrest, which means the breathing and the heart has stopped. Cardiovascular disease, such as heart attack and strokes, is still our #1 killer. This video will teach you how to prevent, recognize, and treat for a heart attack or stroke. You will also learn how to clear an airway obstruction for a choking situation.
Let's begin.
If you come across an emergency situation that requires your immediate attention, the first thing to do is stay back and check the area for danger.
Approach the scene if it appears to be safe. If it is not, stay back and call 911.
Once you've determined that the area is safe, approach the person and try to wake them up by gently tapping them.
Tap or gently shake the person and shout to see if the person responds.
If the person does not respond, immediately call 911. If you're by yourself, you'll have to make that call. Otherwise, try to get someone else to do it.
If the person does not respond, have someone call 911 or make the call yourself.
Once you're confident that 911 has been called, the most important thing to do at this point is open the person's airway, check to see if they're breathing, and check to see if their blood is circulating. In other words, if their heart is still pumping. An easy way to remember this is your A, B, C check, and this is how you do it.
Begin an A, B, C check for life-threatening conditions. A. Airway.
Open the airway using the head tilt, chin lift method.
Tilting the head back and lifting the chin will move the tongue away from the back of the throat and allow an open airway.
Let's take a look at that on a model.
B. Breathing.
Check for breathing by looking at the chest and feeling for air.
Check the breathing by looking at the chest, listening and feeling for air for up to 10 seconds.
If the person is not breathing, give 2 slow breaths.
When giving 2 slow breaths, keep the airway open, seal the nose shut. Place your mouth around the person's mouth with a tight seal. Give 2 breaths, each lasting 2 seconds. Make sure the chest rises. Use a breathing barrier when possible. C. Circulation.
Once 2 breaths go in, check signs of circulation.
Check for signs of circulation by looking for movement, effective breathing, coughing, and appropriate color of the skin.
For the more experienced rescuer, you may also check for the presence of a carotid pulse. To find the carotid pulse, place your 2 fingers on the windpipe and slide them toward you onto the groove at the edge of the windpipe. Check for circulation for no more than 10 seconds.
Let's review the airway, breathing, and circulation check.
Open the airway using the head tilt chin lift method. Check for breathing by looking at the chest and feeling for air for no more than 10 seconds. If the person is not breathing, give 2 slow breaths. Once 2 breaths go in, check signs of circulation by looking for movement, breathing, coughing, and appropriate skin color for no more than 10 seconds. For the experienced rescuer, you may also check for the presence of a carotid pulse.
Things to consider.
Tip 1. Open the airway with a jaw thrust if a head or spinal injury is suspected. Lift jaw upward using index fingers. Be sure not to move the head and the neck. Tip 2. To prevent disease transmission, use protective equipment. A breathing barrier should be used if you feel any risk. Tip 3. If the person is breathing, place them in the recovery position. Take the arm closest to you and lift it above their head. Grab their leg and their other arm and bring them gently to their side. Once they're on their side, monitor the breathing and keep the airway open. And await arrival of emergency medical personnel. Tip 4. If the person begins to vomit, place them in the recovery position. The recovery position will prevent aspiration or choking and keep their airway clear. Please pause the video and discuss how to perform an airway, breathing, circulation check, and the importance of it. Let us learn now when and how to perform adult rescue breathing. Always begin with an ABC check. Following the 911 call, open the person's airway, check to see if the person is breathing, and if they're not breathing, give them 2 slow breaths. Once the 2 breaths go in, now check for signs of blood circulation.
If the person is not breathing, but they still have signs of blood circulating, this means that the heart is still pumping blood around the body. But the person is not breathing. So ask yourself, what is the only thing the body needs? If you answered oxygen, you're absolutely correct. And giving repetitive oxygen is called rescue breathing.
Rescue breathing is given to someone who has stopped breathing but still has signs of circulation. By giving rescue breathing, you provide oxygenated blood, which can help keep the vital organs alive.
If the person is not breathing but has signs of blood circulation, initiate adult rescue breathing for respiratory arrest.
For an adult 8 years and older, give 1 breath every 5 seconds. Keep oxygenating the blood. Do this for about 1 minute, 12 breaths. A few things to remember when giving rescue breathing is to make sure the chin is the highest point of the face. This ensures an open airway. When ventilating, make sure the nose is closed. This will allow the air to go into the lungs. Use a breathing barrier if you have one available. If not, use the mouth-to-mouth technique. Look at the chest to make sure your breaths are going in. Each breath should make the chest rise.
Did you know the air you breathe out contains 16% oxygen and 5% carbon dioxide? This means when doing rescue breathing, you are still supplying enough oxygen to keep the person alive.
After giving rescue breathing for approximately 1 minute or 12 breaths, stop the rescue breathing technique and recheck for signs of blood circulation. In other words, check to see if their heart is still pumping.
If the person is still not breathing but has signs of blood circulation, continue the rescue breathing sequence. Continue rescue breathing until emergency medical personnel arrive and take over. You are too exhausted to continue. The person begins to breathe or vomit. The person loses signs of circulation. The area becomes dangerous.
Please pause the video and discuss the meaning of respiratory arrest and why we give rescue breathing. Let us now learn when and how to perform adult CPR, also known as cardiopulmonary resuscitation. Did you know when the breathing stops, the brain begins to die in 4 to 6 minutes? The average 911 response time is 9 minutes. Without immediate CPR, the person has little chance of survival.
If the person is not breathing and they have no signs of blood circulating, this means that the heart has stopped pumping blood around the body. So what we need to do is immediately give the person chest compressions to circulate the blood and breaths to oxygenate the blood. When you combine chest compressions and breaths, you're doing CPR and you're helping to keep them alive.
Signs of no blood circulation include unresponsiveness, no breathing, no coughing, no movement, bluish color of the skin, absence of a carotid pulse. If you are unsure whether the person has signs of blood circulation, don't delay care. Just begin CPR.
If the person is not breathing and has no signs of blood circulation, initiate adult CPR for cardiac arrest.
To find the hand position, place the heel of the hand 2 fingers above the bottom of the sternum. Crawl up the ribs, place 2 fingers above the bottom of the sternum, and plant the heel of your hand above the 2 fingers.
An alternative way to landmark or find the hand position when doing CPR is to take the heel of the hand and place it directly in between the chest muscles, also known as the lower half of the sternum.
When giving 15 compressions, keep your arms at a 90-degree angle to the body. Keep elbows locked. Compress sternum 1.5 to 2 inches. Do 15 compressions in 9 seconds, about 100 compressions per minute. Keep fingers off the chest.
Give 15 compressions, 1.5 to 2 inches deep. Compressions will force the blood out of the heart and circulate it throughout the body. Give 2 slow breaths to oxygenate the blood now. Continue 15 compressions and 2 breaths for 4 cycles. CPR circulates and oxygenates the blood. It helps to keep the brain and vital organs alive. A few things to remember when doing CPR is to keep your arms at a 90-degree angle to the body. Keep your elbows locked. Make sure your arms are straight up and down. When doing compressions, make sure that you are pushing at least 1.5 to 2 inches deep. If you feel the ribs break, keep going. Let's sit back and watch the rest of the 4 cycles. Once you have completed 4 cycles of 15 compressions and 2 breaths, stop CPR and recheck for signs of blood circulation for no more than 10 seconds.
If the person is still not breathing and has no signs of blood circulation, continue adult CPR for cardiac arrest.
Let's take a look at CPR simulated on a real person.
Continue CPR until emergency medical personnel arrive and take over. You are too exhausted to continue. Signs of circulation return. The area becomes dangerous. Things to consider.
To rescue or CPR can be done if there is more than one trained person at the scene. Each person on opposite sides of the body will share the responsibility of giving 15 compressions and 2 breaths.
And 1, and 2, and 3, and 4, and 5, 6, 7, and 8, 9, 10, 11, 12, 13, 14, 15. And 1.
A person in cardiac arrest requires CPR to provide oxygenated blood to the body. Without CPR, the brain dies within 4 to 6 minutes. Early CPR and defibrillation increases the chance of survival.
Defibrillation.
Okay, everybody clear? The shock coming? Stand clear. Shock in. 1 shock.
A defibrillator is used to shock the heart. This allows the heart to regain a regular and effective rhythm. Maximum benefit occurs when defibrillation is provided within 5 minutes from the point of unresponsiveness.
Clear. And clear. Okay, patient's still in VF. Machine's charging. We're going to shock at 360. All clear. Shocking now. Okay, shock delivered.
Please pause the video and discuss the meaning of cardiac arrest and why we give CPR. Let us learn about the number 1 killer known as cardiovascular disease.
Cardiovascular disease is the leading cause of death in adults in Canada. Over 23,000 people a year suffer from heart attacks. Therefore, it is essential we learn how to prevent, recognize, and treat this disease.
Heart attack and stroke prevention.
Be smoke-free. Be physically active. Know and control your blood pressure. Eat a healthy, low-fat diet. Maintain a healthy weight. Reduce stress. Heart attack.
Heart attack is caused by cardiovascular disease. It is mainly caused by atherosclerosis, which hardens the arteries. If a coronary artery becomes blocked, it will cut off the oxygen supply to the heart muscle and cause a heart attack.
Atherosclerosis. The buildup of plaque caused by cholesterol and other debris that narrows the arteries. Warning signs for heart attack. Heaviness or pressure in the chest, shortness of breath, nausea and vomiting, sweating, cool, clammy skin, radiating pain into the neck, arms, back or jaw, crushing chest pain, fear, anxiety and denial. Did you know? Every year in Canada, 23,000 people die from heart attacks. 50% of these deaths occur before the person reaches the hospital. First aid for heart attack. Call 911 immediately. Assist with any medication such as nitroglycerin and/or aspirin.
Nitroglycerin, a prescribed medication that will dilate the blood vessels and help to bring oxygen to the heart muscle. Assist the person in taking ASA, commonly known as aspirin. Aspirin will thin the blood and can help prevent a heart attack.
Place person in a comfortable position. Loosen tight clothing. Rest and reassure. Await arrival of emergency medical personnel. Be prepared to do CPR. Stroke.
A stroke happens when there is lack of blood flow to the brain. It is caused either by a sudden clot in an artery on the way to the brain or by the rupture of a blood vessel in the brain.
Signs and symptoms of a stroke. Sudden weakness and/or paralysis on one side of the face and body. Difficulty with speech, hearing and swallowing. sudden, severe and unusual headache, impaired vision, dizziness and/or confusion, loss of bladder control. First aid for stroke. Call 911 immediately. If the person is drooling, place him in the recovery position on the functioning side of the body. Loosen tight clothing. Rest and reassure. Await arrival of emergency medical personnel. Be prepared to do CPR.
Let us now learn what to do if you suspect that a person may be unconscious and choking. If the person is unconscious, call 911.
If you come across an unconscious person who may be choking, do an ABC check. And if the breath in the ABC check does not go in, tilt the head further back and try to breathe in again. But if the breath still does not go in, take this as a choking situation and begin CPR immediately.
If your breath does not go in, retilt the head and ensure the chin is the highest point of the face.
The reason why we tilt the head further back, or reposition the airway as we call it, is to make sure that it's not the tongue that's causing the obstruction, and that it is indeed a true choking situation.
Repositioning the airway can be done in two ways. You can bring the head down and tilt it further back, or you can just tilt it further back from the existing position.
If the breaths still do not go in, initiate the adult CPR technique for choking.
In someone who is unconscious and choking, CPR can help relieve the obstruction by increasing the pressure in the airways.
Give 15 compressions, 1.5 to 2 inches deep. Compressions will push the rib cage down, in turn pushing the air in the lungs to act as a force to get the obstruction out. Check the mouth for the obstruction. Attempt 2 breaths. Retilt the head in between the breaths.
If breaths still do not go in, keep repeating the sequence.
Let's take a look at the CPR technique for unconscious choking, simulated on a real person. Give 15 compressions, 1.5 to 2 inches deep. Check the mouth for the obstruction. Attempt 2 breaths. Retilt the head in between the breaths. If you see an object in the person's mouth, lift the jaw and tongue and sweep out the object. If the breaths finally go in, check signs of blood circulation by looking for movement, breathing, coughing, and appropriate skin color. Please pause the video and discuss why we give CPR for someone who is unconscious and choking. How does this work? Let us now learn what to do if a person is conscious and choking.
If you come across a person who is conscious and choking and is coughing forcefully, encourage them to keep coughing so they can use their own gag reflex to clear their own airway. However, if you feel the person is not getting enough oxygen, begin abdominal thrusts immediately.
The abdominal thrust technique is used to dislodge an airway obstruction. By increasing the pressure on the diaphragm, air is pushed through the bronchi, which can help push out an obstruction.
If the person is responsive and choking and cannot speak, cough, or breathe, begin abdominal thrusts.
Get consent before giving abdominal thrusts.
When giving abdominal thrusts, go behind the person and place your arms around the waist. Use the thumb side of the fist. Make sure the fist is above the navel and below the rib cage. Place the other hand on your fist and deliver sharp upward thrusts. Each thrust should be separate and distinct. Repeat abdominal thrusts until the object is coughed up or the person starts to breathe. Special considerations.
Tip 1. If a person is pregnant or too large for you to give abdominal thrusts, give quick chest compressions from behind. Tip 2. If you are alone and choking, give yourself abdominal thrusts by leaning over a firm object and pressing your abdomen into it.
If abdominal thrusts were unsuccessful and the person becomes unconscious, call 911 immediately. Look inside the person's mouth to see if you can see the obstruction. If you cannot, tilt the head back and try to breathe in. If the breath does not go in, tilt the head further back and try it again. But if the breath still does not go in, take this as a choking situation and begin CPR immediately.
Just as we learned, give 15 compressions, 1.5 to 2 inches deep, to push the rib cage down, in turn pushing the air in the lungs to act as a force to get the obstruction out. Check the mouth for the obstruction. Attempt 2 breaths. Retilt the head in between the breaths. Continue the CPR technique for unconscious choking until you remove the object and/or your breaths go in. Please pause the video and discuss why we give abdominal thrusts for someone who is conscious and choking. How does this work? Time for a quiz. Why do we perform an A, B, C check? Is it A, to check the area for danger? Is it B, to check for life-threatening injuries? Or is it C, to try to wake the person up? If you answered B, you're correct, to check for life-threatening injuries. In what order do we perform an A, B, C check? Is it A, open the airway, check for breathing, give 2 breaths, check for circulation? Or is it B, check for breathing, open the airway, check for circulation, 2 breaths? If you answered A, you're correct. Open the person's airway, check to see if they're breathing. If they're not breathing, give them 2 breaths, and if the breaths go in, check for signs of circulation. When do we perform rescue breathing? Is it A, when the person is not breathing but has signs of blood circulation? Or is it B, when the person is not breathing and has no blood circulation? If you answered A, you're correct. The person is not breathing, but they still have signs of circulation. This is called respiratory arrest. When do we perform CPR? Is it A, when the person is not breathing, but still has signs of blood circulation, also known as respiratory arrest? Or is it B, when the person is not breathing and has no blood circulation, also known as cardiac arrest? If you answered B, the person is not breathing and has no blood circulation, also known as cardiac arrest, you are correct. For an adult, rescue breathing is A, 1 breath every 5 seconds, B, 2 breaths every 10 seconds, or C, 1 breath every 2 seconds. If you answered A, 1 breath every 5 seconds, you are correct. For an adult, CPR is A, 10 compressions and 1 breath, B, 5 compressions and 2 breaths, or C, 15 compressions and 2 breaths. If you answered C, 15 compressions and 2 breaths, you are correct. How deep do we compress for an adult when doing CPR? Is it A, 1.5 to 2 inches? Is it B, 1 to 1.5 inches? Or is it C, 1/2 to 1 inch? The correct answer is A, 1.5 to 2 inches deep. When performing abdominal thrusts, the fist placement is A. in between the chest muscles, B. above the navel and below the rib cage, or C. below the navel and above the pubic bone. If you answered B. above the navel and below the rib cage, you are correct. When performing CPR for unconscious choking, what do we do after the chest compressions? Is it A. open the airway and look for the obstruction? Is it B. attempt to ventilate? Or is it C. check the blood circulation? If you answered A. open the airway and look for the obstruction, you are correct.
Thank you for watching this CPR educational video. The information in this video can truly help save a life. But remember, it is not a substitute for live training, and it is recommended to contact your local Canadian Red Cross. You can call them toll-free at 1-877-356-3226. My name is Nick Rondinelli, and have a great and safe day.